I'm Dr. Susan Samuels, and I'm a psychiatrist at New York Presbyterian Hospital Weill Cornell Medical Center. I treat people with a whole host of mental health concerns, including things like anxiety and depression. So what we know about depression is there can be pretty clear triggers. That trigger can be a medical illness. HS is one of those conditions where you can have lots of moments during flares where you're physically feeling unwell. There's physical evidence of your flare-up, and sometimes even there are side effects to the medications you're using to treat your flares. There is a difference between just kind of feeling down and feeling depressed to the point that you really should get help. So you might notice, if you're feeling down and depressed, an overwhelming sense of sadness. Not just the sadness that you've felt from time to time before, but it is really overwhelming. And sometimes people will sleep a little bit more, eat a little bit more or less, not spend as much time with their friends, not maybe even go to work at times. It may be really important to speak to a mental health professional about your coping with the emotional struggles you're dealing with as it relates to HS. And a lot of times it's really important to see a mental health professional to get that help that will sort of round out the treatment. Mental health professionals, dermatologists, primary care doctors can all be very helpful in dealing with some of these reactions. And it is important to not feel embarrassed about asking for that help.